Hi, my name is Zach Carnazes, and I'm a disabled in-home support services recipient, and I'm answering some questions about the program and just sharing my experience because I was told it might be helpful for some changes, some positive changes in the program, and it seems like it would be helpful to hear from people like me who are the recipients of the program and not someone who just works in the program and talks about how great it is without any flaws. I'm going to answer these questions as well as share some of my personal experience. I'm in California and my name is Zach Carnazes. You can reach me best through email. My email is the letter Z, KARNAZES at gmail.com. So it's just my first initial, my last name at gmail.com. I'm a San Francisco resident, so that's the county that I'm in. And yeah, I'll try to just answer questions. Feel free to contact me if you have additional questions. I am really interested in seeing the program be improved, and I think there's a lot of room for improvement, even though it's a very helpful, super beneficial program for people with disabilities. So I'll go ahead and start now. One, are you able? I'll read each question before I answer it. Are you able to find competent in-home support services care providers and support workers? For me, that's been a no, and that for me has been primarily because the in-home support services public authority, which is this like special program. There's a building downtown where they are supposed to help you find a provider, and they have failed at that time and time again. Uh, I've had to go through City Hall and the Mayor's Office on Disability multiple times just to get them to send provider lists, like lists of providers I can call within a timely manner. They've taken 2 weeks, 3 weeks, sometimes even a month just to give me a list of providers with repeated requests. Those provider lists often, all the time, have repeat providers that I've already either interviewed or have even worked for me in the past and have moved on. That's really problematic because those lists are just full of people that either that or they don't even work for the program anymore, or they live too far away. These kind of things. They don't actually screen the people very well, it seems, from the lists that they give us. It's very hard to get a list. When I say that it takes a week or 2 weeks or a month, this is over email, which is crazy. Like their excuse is, well, oh, it takes a while to send a letter through the mail. I said, no, this is email. You can't answer an email that your job is to answer with a provider list. It takes you 30 seconds, maybe a minute. I mean, I don't know how long it could take to renew a list and send it over email. It takes them a very long time, and only with the prodding from City Hall have they and a formal multiple grievance complaints have they even been doing that. I think the public authority has just been awful in every way, really bad. It took me 6 months of calling multiple people. Numbers were disconnected, all sorts of stuff. Talking to multiple people on staff to find out when their public meetings were, so I could ask them, what was going on and give some feedback, get some improvement, that sort of thing. 6 months to find out when a public meeting was. They refused disability accommodation originally for that public meeting. Again, I had to call City Hall and go to the Mayor's Office on Disability to get that reversed. They were, they were really pissed to see me at that meeting. They did not want my public comment. I had to wait 2 hours at the meeting to give a 5-minute public comment as someone who uses the service, as one of the only people they've had in those meetings in what it looks like years to even share their experience. It's very clear that the public authority here in San Francisco is not interested in hearing from recipients about what the experience is like, about improvements that can be made. A lot of this blame I do lay on Kelly Dearman, who's the executive director and has been appallingly difficult to work with. very non-responsive, very adversarial, very unaccommodating. Something as simple as a recipient support group that I've asked for, a place where recipients can meet with each other, either by phone, voice chat, in person, at the public authority. We could solve some of the problems on our own, maybe. We could help each other out. So that would save them money, save them labor of having to answer every single question under the sun. And we could get to know each other. And, as one disabled person to another, I might have different ideas and things that could help. They weren't interested in that at all. I said maybe just an hour a month if you could have a room available for us to meet. I could help make a flyer, something. And Kelly Dearman absolutely refused. Only through a lot of fighting with her and with the Mayor's Office on Disability helping me, would she even include information of when the public meetings were happening in their materials that they mail out. For years, they didn't even say, we have governing board meetings, public meetings at this time, you can attend. When I finally got them to do that, they didn't put the times that the meetings were and the dates. And it just fighting me every step of the way to be involved in the program in a way that's constructive and trying to improve it or give feedback. So yeah, I have a lot of complaints about the public authority. And because of how hard it's been to get information about providers, to get provider lists, to get providers that are competent, that's what this question is asking. I had a provider from that list come over and go through my trash looking for cans and bottles during the interview. Like, I've had providers obviously check out the place for stuff they can steal, like scoping the place out and going down my hall and looking in rooms. Really suspicious stuff, really dangerous stuff. And the public authority doesn't care. I make these complaints, I mention them to Perry V, I can't pronounce his last name very well. He's the head of the mentorship program that's supposed to help people like me get a provider. He's awful, absolutely awful to work with. And he's refused accommodations for me. He's refused to help me get a mentor, to help me hire somebody. I went so long. I mean, I did something like 50 interviews in the past year. 50 interviews trying to get a provider. Part of that is the pay is so low. Anyone that's going to get paid $16 an hour, I mean, that's sure, it's minimum wage. I'm glad that the money's there to help, but it's not enough. Every provider I've had that I've hired through the system has come from the East Bay. And if you come from the East Bay, that's an hour plus train ride. And then you got to go home. I had a provider that worked for me for a short while. Her name was Anna. She was very nice. But she had to leave early because she was afraid of walking home at night, after all the transportation to the East Bay in the neighborhood that she lived in. And so she couldn't be here as much as I needed her. Stuff like that. If she lived closer, that wouldn't even have been an issue. It wouldn't take her an hour and a half or 2 hours to get home, and so she wouldn't have to leave, as early. Stuff like that. Any provider I've had that's been decent at all, I've found outside of the public authority lists. The public authority lists are a joke. The people that show up, I had somebody show up and ask me if I could fill out their timesheet for their sister. I had somebody show up that I interviewed who sat in my room, looked me dead in the eye, and told me he would only work for me if I put twice the hours that he worked. He lives 4 houses down from me. He lives in the same neighborhood. And I called public authority. I said, this happened. And they said, oh, well, tell us who it is. I'm not going to rat on somebody that's in my neighborhood that could hurt me. We are very vulnerable. People with disabilities, I use a wheelchair. I can't run away, and I'm not trying to rat on people that could physically harm me or that could retaliate against me. And there's no protections for us for that kind of thing. That person sees me on the street later. Who knows what they're going to do? They're already trying to do illegal things, and so I don't really like the fact that it's up to us to report these things without safety measures. And And even when we do report them, I've asked Kelly Dearman, she's told me there's no guarantee that somebody will be taken off a list. She's told me that, I've asked, well, if say you get 3 complaints like that, does somebody get removed from the list? Nope. It's up to their discretion. It's up to their discretion whenever they want to remove somebody from the provider list. And why is that? I can only imagine they just want the numbers to look good. They want to say, we have so and so, this many providers for people that with disabilities, and it looks good on paper. But are those providers going to show up? Are they going to follow the law and not break the law? Are they going to, be able to show up on time and be able to leave on time? Like punctuality is a huge thing. I've had so many people flake on interviews. I had somebody flake 3 times in a row and tell me 3 different lies. And then by the 4th interview, I was like, I couldn't even, it's just a waste of energy. I don't have a lot of energy, so that's important. Listen, it goes on and on. I'll try to go down to these questions, but I'm just like, there's things that, that's a big question. Are you able to find competent care providers and support workers? The answer is no, unless it's a friend or somebody that I managed to bump into who's needing work at that moment, which has not happened for me very often. But am I able to find care providers through the system that's supposed to be available for that? No. And I've called Independent Living Resource Center. I've called so many other places, and they don't have provider lists. Everything goes through the public authority now, and the public authority is a mess. It's really bad. Number 2, are the IHSS public authorities or similar contracted entities working for you to find providers for you? Are they helpful or not? Well, I just answered that. They're not helpful. They're really terrible. The mentorship program, which I was in for 2 weeks, there was a guy named Josh. Was it Josh? I think this was a while ago. This was last year. And he was very nice. He came over to my house, taught me about the program, helped me conduct interviews. I have steps going up to my place, so my place is not wheelchair accessible. So I can't conduct interviews very easily myself. I've had to throw a key down a hallway and stuff like that, to somebody I don't even know. And so I'm like, I really need help conducting these interviews. I don't have anybody here to open the gate, and I'm trying to get a ramp, and my landlord's fighting that, so it's not been easy. And so, Josh came by for 2 weeks. There was a woman named LaShawn, and she was the mentorship coordinator at the San Francisco Public Authority. She was very nice. I really liked her. And so was Josh. And both of them were doing great work. I was like, wow, this could finally work out. And then LaShawn was fired. I have no idea why. She was actually going to extend that 2 weeks to 4 weeks, which I was really looking forward to. She was fired, and her boss, Perry, wouldn't tell me. In fact, he was really upset that somebody had told me she was fired. And he was like, who told you that? And stuff like this. He's a very aggressive guy, despite how he pretends to be. And I don't know what happened there, but as soon as LaShawn was kicked out, no one would renew my mentorship program. They said, oh, we'll have somebody call you to help you with these things. I'm like, how does that help me answer the door? How does that help me conduct interviews that are safe so people aren't trying to look for stuff to steal or going through my garbage and this kind of stuff, We'll just give you a call. Those calls didn't even happen. After complaining for weeks of not even hearing from anybody, I finally got somebody to call me, somebody named Maria, and the call happened during my doctor's appointment. I asked them if they could make the call a different time than my doctor's appointment. Perry fought me on that as well. Didn't want to do it. It was a joke. The mentorship program is an absolute joke. And what's really frustrating, and what I've asked from them, is if they could at least on the flyer, I should pull it out. Maybe I'll get a picture of it for you. But there's a flyer, and it says it's got a person in a wheelchair with like a nice lady with the arm on their shoulder, and it says the peer mentorship program is here to help you every step of the way. It's like very touching, right? It's not true. It's a lie. Like, it's an absolute lie. And I said, look, if this program is not going to do what it's advertised to do, can you at least change the advertising? Can you at least do that? Just change the flyer. Perry and Kelly Dearman were not having it. No, absolutely not. They're lying to us, and they're not providing the service. And that's a problem. Are mandatory criminal fingerprintings and IHSS orientations inhibiting access to workers in your community or limiting access to emergency help? That's a mixed bag. I think the fingerprinting can be good because of safety issues, but the cost of it is the problem. It's the fact that it's $40 or whatever it is right now. And, for a $16 an hour job, you have to go through all this extra work. You have to pay this extra money up front. You have to get that documentation, then take it to an orientation. Then, if you get an appointment, which usually takes a month, then you have to provide your bank info. That takes sometimes another month for the payments to start. So you have somebody who you don't know, who's usually underqualified, not punctual, can barely hold a conversation a lot of the time. And I'm not talking about, English as a second language stuff. I'm talking about just like not all there to have a conversation about, I need you to get this from the store. I need you to, do this. I mean, some of these people are just, I feel like they need to be on disabilities because they are very, they can't hold a conversation. They can't hold this basic job. And I'm very clear, and I try to be super patient and super clear about the things I need. And it's hard. And so, yeah, the orientations and the fingerprinting, I feel like are good, but the pay needs to start when the work starts. And when I need help, or there needs to be somebody that can fill in. I have called my social worker in the past to ask for emergency services to fill in when I haven't been able to get a provider. My social worker is Lisa, and she said absolutely no. She said, "Oh, is you in the emergency room or something?" Well, then no, you're not going to get emergency support services. So what does that mean? I'm looking for a provider for months. Maybe I find somebody. It's months before they get paid. By the time they're going to get paid, a lot of them quit. It's not worth it to them. They found another job that pays $20, $30 an hour. I think you can make more than that. Some places around here just serving food and stuff. I had a care worker that was fantastic. Her name was Akila. She worked for me for 6 months or something, maybe 8 months. She was fantastic. She got a job serving pizza for twice the pay, like $30 an hour, almost twice the pay, serving pizza by her house, which is way closer. Why would she work for me? The pay is really low, and to get in the system is so hard. My most recent provider, who's helping me right now, had to go to like 3 different places and spend 2 hours or something trying to find the right place. And this is, they're very smart. They looked at the website, they showed them all the links. It's confusing. It's very confusing, unnecessarily so. Are you going without care to meet your authorized IHSS service hours? Are you going without care to meet your authorized? Well, I have gone without care a lot. I have some now because I have a friend who agreed to work for me who still hasn't been paid. They started a while ago, but they're still trying to get paid. But that was kind of dumb luck. It's kind of temporary. They're in school and they were like, okay, I can help you out. But they're like, I can make more money working at Chipotle. They're helping me out right now because they know I really need it. But yeah, there's a lot that needs to change to find a provider that it's not a friend, and the friends is temporary. They can make more money doing other stuff, and it's not charity, So I have, it's been very hard to fill the hours that I need for this year, especially this year, ever since Akila got the job at the pizza place. It's been very hard. And I actually have to go. I'm going to make this a 2-part video because I have to call my doctor in a couple minutes here. What's wrong with the IHSS system? I just explained that. The IHO waiver system, I actually don't know what that is. Maybe somebody could tell me. How are difficulties affecting you? I just explained that. What can make it better in your opinion? I explained some of that. A support group. A support group would be so important that people like me could connect with other people. Video chat, calls, or in person. An hour a month at the public authority is reserve a room for an hour a month. Set up some teleconferencing. That's it. Higher pay. Higher pay is absolutely ideal. Better or better provider lists, and have the provider list be available at ILRC, have them be available other places, not just the public authority. Have people screened, have them actually kick people off the list that are not showing up for interviews, that are not working for them anymore, that are really sketchy people that have had serious complaints, that are trying to break the law. Take those people off the list, recruit people that are quality individuals that are qualified for the job. How do you get qualified individuals? You screen for them and you pay them a livable wage. 16 an hour is not a livable wage in San Francisco. Almost everywhere you go, you get paid more than that, for almost any job. So, and especially, it's not, you want to go make burritos at the taqueria down the street. You don't have to wait 2 months to get paid. You don't have to go running around San Francisco trying to find the right building. You don't have to get, if you do have to get fingerprinted and stuff like that, you don't have to spend a bunch of money doing it and go, waiting a bunch of time and, go to different places. I mean, it's a medical job, right? It's a type of a medical care job that requires just a little bit of extra work and expertise to do it right. I don't think 16 an hour and a 1 or 2 month waiting period to get paid is appropriate for that. As I mentioned before, having available fill-in providers when we are having a hard time finding somebody. Maybe you could call it urgent provider services instead of emergency. I don't know. I'm going to keep going through this list. I have to make this a two-parter. I'll try to see if I can edit this later, but I have to call my doctor right now. Thanks for listening so far. And again, I'm gonna finish off the rest of these questions, and hopefully this is helping. Hi, this is Zach Carnazes. This is part 2 of a video just documenting in-home support services issues, and I've got some questions here that I'm just answering because I think it's these were sent to me as like helpful questions to kind of start off talking about my experience. I'm just hoping that some changes can be done to improve what is a very helpful program. It's a very good program. It just needs some improvement, especially for getting providers. Question 8 here is what problems are you specifically experiencing? I think I covered a lot of that already. The issue of getting providers paid is a big one for me right now because the person that's working for me hasn't been paid yet, and they are on a very tight budget. And honestly, if I didn't know them already, they would have quit a long time ago because of that. So that's a big problem, is people that either can't afford the fingerprinting or all the bureaucracy is confusing, and then by the time they've gotten through it, they've already quit. They've already found a job that pays more money and has less bureaucracy and confusing stuff. Availability is a huge problem as well for providers on the lists. A lot of them want only very specific hours at very specific times. It's very hard to find providers that are available in the evenings, for example, or late afternoons. It's very hard to find. It's very hard to find providers that want to work part-time. Most providers want a lot of hours, and that's all they care about. So finding people available at different times a day or to work part-time is difficult. This is if you can find a provider that actually shows up that you like. And this all has to do, I think, with just the small number of available providers that are actually will show up and actually answer your calls and actually are still working for IHSS, because those provider lists that they send are just so dramatically inaccurate. So yeah, that's a big problem. Transportation for providers is a big problem. A lot of providers for the low pay have to travel very far, and IHSS doesn't cover their transportation expenses, as far as I understand. So that's a problem. That's a problem. They only cover transportation expenses if they're coming with me to a doctor's appointment. Okay, but yeah, I mean, if it takes somebody 2 hours to come into work and you're not paying them for that 2 hours, why would they choose this job? Especially, the pay is so low, and that's the only reason why you get somebody in the first place, is because there's pay at all. But if, you're not going to get people locally here in San Francisco that are going to work for $16 an hour. It's just not going to, it just doesn't happen. It's only been like a friend who's doing it as a favor, essentially, who's got another job already. And you know, that's not always available. See, that's a big problem. The problem I mentioned before of getting emergency services, getting coverage when you can't find a provider. So if the public authority is not giving us mentorship help, especially in-person mentorship help to help me answer the door and stuff in my wheelchair and help me conduct interviews and that kind of thing, and screen, help me with screening, making sure that the provider lists are accurate. If you don't have all those things in order, and like I said, I've done over 40, 50 interviews in the past year. I've done so many interviews. You don't have any help. What happens to you during that time? There's a program called Homebridge, which will give you a provider no matter what, but only if you match very specific qualifications. They won't accept applications right now. You have to have like dementia or like severe mental disabilities to qualify, from what I was told. So what do I do? What do I do? I mean, finally got this friend to help me, but I mean, I went 6 months without having my bed sheets cleaned. I had mice infestations in my kitchen, and I couldn't do anything about that. My refrigerator's broken right now. It's leaking out water from out of the freezer, and I can't do anything. I just put a bucket under it. I mean, the list goes on. Making it to doctor's appointments, I haven't been able to pick up my medication. Um, you know, I'm having to juggle between my provider taking me to my MRI appointment this Wednesday or picking up my medication, and I'm trying to figure something out, but it's rough. I'm too exhausted to do all that stuff myself. And yeah. Anyway, going further down the list, are you afraid that electronic visit verification will make it harder for you to find personal care workers once implemented? Absolutely. Absolutely. What's one of the biggest problems with finding care providers? Unnecessary bureaucracy, too many restrictions, expensive bureaucracy, not enough work flexibility. I mean, these are things, and the low pay, electronic verification would be fine if the pay is $50 an hour, but for 16, who's going to want to do that? Who's going to want to deal with more problems like that? More bureaucracy, more headache, more stuff to report, more things to do. No one's going to want to do that. And it's just, yeah, not good. What do you think, question 10, what do you think is needed to make it easier for you to lead a normal life in the community in your own home? That's a good question. I feel like that's a large part of the goal of in-home support services. I feel like a broken record. I've answered, I think, some of these questions already. I need help with basic needs. I need help getting my medication, getting to doctor's appointments, getting food prepared, helping me, around the house, helping me clean the house and chores and getting groceries. These are things that I need help with. And that's what in-home support services is supposed to be there for. Taking me to the hospital when I need to go to the hospital. Yeah. Those are the things I need to make my life easier. I kind of think about it as the things that a lot of people like do on a Sunday, like the stuff around the house. But it's a problem, when you can't do those things and you're just living in your own filth, and it's a problem, you don't have access to like very basic stuff. And I mean, it takes me so much energy to use the bathroom. So yeah, these are things that I need. Are you afraid you might be forced into a nursing home if you cannot find workers to help you continue to live in your home? Absolutely. That's one of my biggest fears. Uh, you know, it's a very scary thought, and losing my freedom to live independently is terrifying. That's kind of like all I have, I feel like, a lot of the time. Um, and yeah, it's a very scary thought. Um, what is your age? If you are you a senior? Um, I'm 32. Not a senior. I wouldn't say I'm in my youth. The question says, are you in your youth? I'm middle aged, 32. Does your gender or sexual orientation affect your access to care providers and worker preferences? Personally, I think it's harder to find care providers that are women who will work for you if you're male. That's been my experience. Um, I think there's a lack of protections for both providers and recipients. I have asked the public authority what they will provide in the instance of an assault or trauma support services for recipients. If we are attacked by a provider, if we're sexually assaulted by a provider, their answer is that they do nothing and that they just refer us to adult protective services. This is not appropriate, in my opinion. I think they should have somebody on staff, absolutely, to answer a phone call about that, someone who's trained in that. Doing outside referrals for that is not appropriate. You are in home support services. You need to make sure people are safe. That's a priority. Adult Protective Services has a huge, huge wait list, and it can be a week or more before they send somebody out to help you. Like, you have to prove that you're in imminent danger and there's like screaming in your house or whatever. This is how I've understood it. This is what I've been told. The times that I've called them, they've been like, yeah, we can see you in a week. Um, that's a huge problem. That's a huge problem. There needs to be absolutely trauma and emergency domestic violence support services for people that are disabled who are at high risk. We're at high risk for that kind of thing. We're inviting a complete stranger into our home with the knowledge that we cannot protect ourselves, that we cannot defend ourselves, that we are vulnerable, that we lack resources. And you don't have any sort of process at IHSS or public authority to protect us other than just referring us to an outside agency. That's ridiculous. That's unacceptable. And the same goes for providers. They need to have some protections as well. I'm not a provider. I don't know what protections they do have, but I have been told by IHSS Public Authority staff that providers have, had creepy recipients and stuff come onto them or try to touch them or do other really inappropriate things. And so there needs to be some protections for them as well. And I don't know the answer to all of these things, but I think the starting point, the one starting point, is a person on staff at IHSS whose job it is to handle these complaints. I've asked public authority to include literature, in their literature that they send out, include information for trauma services and domestic violence support services for recipients and providers alike. Kelly Dearman refused, said she doesn't want to do that because it could give a bad image. Don't know what she means by that, but that's what she said. So she refuses to do that. I mean, the message is clear. Like, we don't matter. Disabled people with these kind of needs don't matter to the public authority. Don't matter to the executive director. Don't matter to the governing board. I address these problems, all of them, to the governing board. I have a video online. You can see it on YouTube where I'm addressing all these problems. Brought it up at the Mayor's Office on Disability multiple times. They don't care. They care to do just enough not to get sued. That's it. And that's not a public service. That's not a social service. That's people that shouldn't be in that position. Shouldn't be in those positions of power if they don't really care and want to improve the services that they are providing. Question 14, what reforms do you want to see in home and community-based services? Already covered that. I'll say it again though. Try to do bullet points here. Provider lists that are recruited, so recruiting providers, actually finding providers that are qualified, and making sure that they are still active, making sure that they show up for work, they show up for interviews, making sure that their background checks out, they don't have a criminal history and stuff like that, or at least they don't have an active criminal history. I don't know what the regulations for all that stuff is, but just making sure people are reliable and can work the job, making sure their phone numbers are active and stuff like that, their contact information is active, making sure that the provider lists they're giving you are not people you've already had work for you, that have already quit or not showed up to work. Making sure that you purge people from the providers list that have complaints against them. Have a very clear process for doing that. For example, if a person has 3 complaints, they are suspended from the provider list or something like that. But giving the public authority complete power and control over deciding who or who doesn't get on those lists based on their whim, based on we don't feel like doing it, that's not appropriate. There really needs to be oversight for the IHSS Public Authority. Either get rid of it and replace it with something better, which honestly sounds great to me. But if you can't do that, give it some oversight. One of the big problems I had with the IHSS Public Authority is there's no one to complain to if you have a problem there. Mayor's Office on Disability doesn't actually have that much control over them, and the Human Rights Commission here in San Francisco has no jurisdiction over them either. So they can commit human rights violations, they can commit social services violations, they can commit nonprofit violations, and there's almost nothing you can do. I mean, you can make complaints on the state level, but no one's going to listen to those. And so they know this, and they know they operate more or less with impunity. And that's a problem. When you give people a lot of power and you have no oversight, that's a problem. Like, the reason our government works so well is because we have checks and balances. This program does not have checks and balances. The IHSS Public Authority program is what I'm referring to here in San Francisco. The public authority needs to be badly reformed. Badly. And Kelly Dearman should, gosh, she's horrible. There should be support groups. I feel like there should be, at minimum, just have an hour a month. 1 hour a month at the public authority or someplace like that, where recipients can talk to each other, can share ideas, resources, things that work. This will save everybody money. Everybody will save money. Government will save money. Public authority will save money. The complaint agencies will save money. We want to work with each other. We want to be empowered. And, not all of us can. Some of us are very sick and can't communicate well, have different limitations, but I'm sure we all want to. I definitely want to. I know other people that want to. And keeping us isolated, misinformed, not knowing when public meetings are happening, that's a problem. Speaking of public meetings, absolutely, I believe very strongly, and I don't know if this is possible right now, but I believe very strongly that we should be given hours to attend public meetings at IHSS. We should be given hours with our worker to engage in the services that affect our lives. So if I can't get into a cab with my manual wheelchair by myself, but I would like to go to IHSS and speak about some of this stuff. Well, my worker doesn't have hours for that. They're making decisions at that public meeting that's going to affect my life and the life of thousands of disabled people. We don't even get a say to attend. I had to fight with them for months to get them to set up a phone line. Doesn't work half the time. They don't call you back. There's a time they hung up on me. It's all documented. They won't set up a video system in 2019, as if that's hard to do. And they make you wait 2 hours before making a 2-minute comment. This is not okay. We should be able to be included in the decisions that affect our lives. Hour a month. It doesn't have to be a lot of time. So I think that's important. One thing that I wanted to address that I don't understand is that in-home support services, we don't have hours for getting our hair cut, for grooming. I imagine somebody got hurt with a pair of scissors at some point, but it's very hard for me to cut my own hair. It's what I've been doing. It's not easy to do. I can't afford barbers and stuff like that. I would like to be able to have a provider that could help me with that. If there's a waiver I need to sign that says nobody's responsible if the shaver nicks me or whatever, I'll sign that. But just telling disabled people, no, you never get any help with a haircut ever, that's not a solution. We need help with things like that sometimes. Grooming is, it's part of being a human being. It's part of living in your community. I mean, I went for a period where I had this huge beard because my hands were too messed up to shave. My hair was like super long. I looked like the Thing from the Addams Family. And it's just humiliating, and hard to take care of, itchy, and it's just like that's part of being human. Is you need help. You need to groom yourself, and if you can't and you can't afford it, then in-home support services should help with that, or there should be a program or something that can help with that. But I certainly see no reason why a care provider couldn't help with that, especially if somebody signed a waiver. As far as other reforms, though, I think I've touched upon a lot of this. I think other agencies need to be involved in providers. Independent Living Resource Center used to do that, and I think that would be better, honestly. Having a base like that where people can go to get more provider sheets. Having everything just locked in this public authority is just problematic. The other thing that we should really, really have more control over is our social worker, our IHSS social worker, who were assigned. As far as I understand it, it's almost impossible to change social workers. If you have a problem, total abuses of power happening there. Social worker can deny anything to us. They could, it's crazy. And I've had that happen for emergency services. I had that happen when I was trying to get into the mentorship program. I was told to ask my social worker, Lisa McCarthy, I think is her name, if I could, I need to get into the mentorship program because I'm having trouble getting a provider. And I mean, she did everything she could to deny the referral. Why? I don't know. I don't see why that would harm her at all, but she didn't want to do it. If you need extra hours, extra help, they have no incentive to do any of that. They have total power over you. And if you have a problem, the complaint systems are a joke. You can't change service providers or social workers. It's almost impossible. And if you do complain, they can use that against you. They can retaliate and say you're just a problematic recipient, not grateful enough, whatever. So there really needs to be more accountability and more involvement in how we have a say in how this program works. Because like I said, it's a good program. It really does keep us out of hospitals. It really does keep us in the community and functioning in the community. And I'm super grateful for that. I hope I don't sound like I'm ungrateful, because I'm super grateful for it. And I've said this at public meetings. When I go to say a complaint, I also say the positive. I say the things that have helped me. It is a terrific program. There are just things that need improvement. That's all. I got two last questions here. I know this is a long video. I appreciate if you're watching this still. Question 15, is the health insurance negotiated by your county and provided to IHSS providers adequate? I don't know much about that, so I can't really answer that since I'm not a provider. And 16, what would help make it better to attract IHSS care providers and support workers to work in this field to grow the workforce and pool of available workers? That's a very good question. Advertising, almost nobody knows this program exists. I mean, I have to explain to people all the time what it even is. So like good advertising, and they could easily do that around the city. Higher pay. Number one is higher pay. maybe reviews. It'd be cool to have a site where people could review providers, and you could have, just kind of getting the word out. It's like this super secret, program, and nobody knows about. It's super complex and convoluted and requires all this amazing amount of bureaucracy, and it doesn't need to be that secret. you know I've never seen it advertised ever, and I'm tired of having to explain to people what it is.